So we've been doing a lot of baby and a lot of ovarian cancer stuff and endometriosis. And now I want to shift gears because I haven't talked about like two of my favorite subjects. And I say it as if it's like so sweet, but really what we're going to talk about, especially as all my young patients start coming home from college, HPV and herpes. This is not going to be a grand HPV and herpes talk because there's so much to talk about. This is going to be a higher level, kind of emotional, yet condensed HPV and herpes talk. This is what I mean. This is how I discuss HPV and herpes in general to my patients in the office. If you are a young woman who has been to me, and we've talked about STIs in general. Those of you who don't know, STIs are sexually transmitted infections. We used to refer to them as sexually transmitted diseases. Disease sounded pejorative and judgy, and so we now say STIs. I have to be honest, it still rolls off my tongue to say STD because that's how I trained. So I still say STD. So STI, this is what I say to people in general when I'm speaking about the STIs to women. And ideally, I'd love to catch the women prior to embarking on their sexual time, because that's the best time to really educate them. So it would go something like this. I don't know if you're having sexual intercourse yet. I don't know if you're sexually active yet. And I really try when I can to be very neutral about, I don't know if you're having any kind of sexual relations with, you know, men or women or boys or girls. And I don't want to be like boys or girls because that sounds so diminutive. But sometimes when I'm with someone younger, 16, 17, 18, saying men or women also sounds so kind of, I don't know, aggressive, right? So I try to be neutral because I want to really leave the door open for people to feel comfortable talking about it. We live in a fairly homogenous area. There is a very varied demographic in the city in which I practice, but I draw from some towns that, let's face facts, are very, very, very homogenous, and people don't necessarily feel comfortable coming forth if they are having relationships that don't necessarily seem as acceptable to the general population, which is too bad. But I want people to feel very comfortable. And you out there, whoever you are, you should feel so comfortable talking to your practitioner, whether it's your doctor, your nurse practitioner, your PA, your family practice doctor, your pediatrician. You should feel comfortable talking to them. And if you don't, then that actually means that you should find someone else, because you need to be open with them. They are there to help you. They are not there to judge you. And if you are feeling judged, then either it means you have to come to terms with the fact that you need to be more open with someone. And if it can't be your family member or one of your best friends or a clergy person or someone that you're close with, then it needs to be your physician, your NP, your PA, but find someone that you're close to, okay, that you can confide in. And if that person doesn't give you confidence, then you need to go find someone else, because that's important. And really, like I would say, even if you can talk openly to your family member or your friend, please talk openly to your doctor. It's important. They need to know what they need to help you with. Okay, back to HPV and herpes. I went off on a tangent. So the reason I focus, honestly, a little bit more on HPV and herpes than the other STIs is that often they're the most common, right? If you use a condom, if you're having heterosexual sex, you will prevent HIV, hepatitis, and syphilis, not 100%, but really close to it, because HIV, hepatitis, and syphilis are largely found in semen, blood, or if you're getting a blood transfusion, which we're not discussing here. So in the realm of sex, it's found in semen. It's not found on the skin. If you have chlamydia or gonorrhea, again, it's found in semen, right? So the exchange of semen is typically how you can get it. Now, can females to females transmit those entities? Absolutely, they can, but it's less common. So again, in situations where people are having heterosexual sex, condoms will largely prevent HIV, hepatitis, syphilis, and gonorrhea and chlamydia. If you are having homosexual sex, condoms will prevent those. If you are having female homosexual sex, dental dams, which is essentially like a unrolled condom, it's like a piece of latex or non-latex type of plastic that will prevent transmission of those things. The likelihood of women using dental dams is really small. Females, weigh in on this, let me know, but I'll tell you, in my population, it's like, I think in 22 years, I've had one patient who's told me she legitimately uses it. Anyone else has kind of looked at me like, what is that? I don't know what you're talking about. Now, viruses like Herpes and HPV, on the other hand, unlike HIV or hepatitis, live on the skin. And they don't just live on the skin that's on the shaft of the penis or inside the vagina. They live on the vulva. They live outside the vulva, which, remember, the vulva is the outside of the vagina, the outside part. They live on the skin that's around even like the interior of the thigh, like the thighs. They live sometimes on the buttocks. They live all around the outside of the penis and the scrotum. So you can get herpes and HPV even if you've had one lifetime partner, and even if you said, but Shiva, I used a condom every single time. And I'm going to say to you, but I believe you, because I know how people get herpes and HPV. It happens all the time. And I'm not worried about it. I'm not freaking out about it. Not because it doesn't cause distress. I get it. But I try to purposefully, frequently, calmly, and like casually say to patients, it's really common. Don't freak out. So I'd like to preemptively tell any of you who have not yet embarked on your sexual livelihood, please just know that if you choose to have sex, even if it's one person for the rest of your life, you may get exposed to herpes or HPV. Now, if that one person has never had sex with anyone else, it's less likely. But if that one person has had oral sex with someone else, then it is possible that that one person could have been exposed to herpes or HPV, because you can get oral transmission of herpes or HPV. Again, they're viruses. They can live in our mouth, in our throat, on our genitals, and you can get transmission through that. So again, you can get asymptomatic shedding, meaning no big cold sore around my mouth, no big cold sore or open weeping wound on your genitals, no sign of HPV, because most people don't have any signs or symptoms from HPV. And all of a sudden, lo and behold, you could pop up with HPV. Okay, so herpes and HPV, I lump them together because they are viruses that can be transmitted asymptomatically with no symptoms, that means, and then all of a sudden, your partner, man or woman, gave it to you, you had no idea, and you have it. You don't even know which partner you had gotten it from. Meaning, if you now are married and you pop up with this, you cannot blame your current partner because you could have gotten it from a former partner. This happens all the time. And again, there are so many more granular details and stories and examples we could go into. I'm actually working on it should be 3 parts, but it could be like 10-part series to transmit about this, because there are multiple different situations that become very confusing for patients, where like suddenly someone comes in with a new open cold sore. Could it be herpes? Yes, it's probably herpes. Is it herpes 1 or herpes 2? Well, it could be either. And is it a new onset? Was she just exposed, or was she exposed a long time ago? Well, it depends on a multiple variety of factors. Like, is it one lesion? Is it multiple lesions? All these different ways I could describe it that will help us tell you whether it's recent exposure, long time exposure. Do we think it's herpes 1? Do we think it's herpes 2? How do we test for it? So there's a lot of different permutations. When it comes to HPV, there's 2 broad categories. There's the type of HPV that causes abnormal pap smears. There's the type of HPV that causes warts. The type that causes abnormal pap smears might turn into cervical cancer, but that's not so common. So those of us who have the type that causes cervical cancer will not get cervical cancer, most likely, if we're really compulsive about keeping our immune system strong, meaning no smoking, boosting your immune system by eating a large variety of vegetables and immune boosting foods, keeping your body healthy, and going in for your pap smears. How often should you do your pap smear? Talk to your doctor, because there are different varieties of testing regimens based on your personal needs, based on your immune system and your age and different factors, right? Why would you need it more frequently or less frequently? Again, is based on a variety of factors like age, your immune status, all these different things. So you need to talk to your doctor about it. So do you need to be scared if you have HPV? Lord, no, because what percentage of us have HPV? Say it with me if you've heard me say it. 80 to 90% lifetime, 80 to 90%, right? So if you're watching this and you're in a room full of 10 people, you're probably not in a room full of 10 people during the COVID, but 8 to 9 out of the 10 people that you would have been in a room with prior to the pandemic had it and didn't even know it. Because many people are walking around, they never had a pap smear, they didn't know it. Or their pap smear came back normal, but they still had it because it didn't make the cells abnormal. Again, that's a whole nother topic we can talk about, is pap smears with regard to HPV, because many people have HPV without knowing it. Herpes, on the other hand, many people have and they never got tested for it, because the only way you know you had it is either from an outbreak or by getting blood tested. Herpes has two strains. Herpes has many strains, by the way, but the herpes we're talking about, the oral cold sore strain, the genital cold sore strain. There can be some cross-reactivity. Again, so much to discuss, but in general, herpes and HPV, very common. Herpes and HPV should not be stigmatized. Herpes and HPV are often stigmatized. People freak out about them. People feel deeply depressed about them. There are actually multiple Instagram handles about this of women, probably men, but you know, in my demographic, it's women who are trying to debunk and destigmatize. And I'm so glad about that. So kudos to all you ladies who are doing it, because I think it's great and amazing. And I hate being like so brave, because it shouldn't have to be brave, but it is brave that you guys are being public about your own, you know, your own herpes. I think that we should talk about it more openly. I think we should talk about it more frequently. I think that everyone should get tested. That is anathema in our world, because the CDC does not encourage testing. Yes, it would be a burden on the system. Yes, it would open a whole Pandora's box. I have many feelings about it. I can't say that our public health system, which we have a terrible one of, is up to the task. But in theory, I wish we were, because I think that alone would actually decrease a huge amount of anxiety I see daily, emotional toll from the burden of herpes and HPV. Anyway, those are my thoughts. I hope you enjoyed this on this Wednesday morning. Booyah, herpes, HPV. Okay, on a more serious note, there is some serious just stuff going on in the world. Israel and Palestine is not a pretty picture. It's just not. What's going on with COVID is, I don't know. Is it getting better? I guess it's getting better. The vaccine, I'm feeling very optimistic on one hand, and I'm feeling still really sad and worried about a lot of vaccine misinformation on the other hand. I'm generally loving humanity and feeling angst about humanity. I guess those are my thoughts on this Wednesday, May 12th. So there you have it. Those are my nuggets. I hope you all have a great day. Okay, I'm gonna go see some patients.